Hello, my name is Alia Alicia, and I'll be talking about the discourse in healthcare settings, how the human connection is the best medication. This is me right here, and this is the index, and we will go through the introduction, problem statement, research objectives, research questions, literature review, research methodology, research findings, and conclusion. Introduction. In the complex, multifaceted realm of healthcare, discourse plays a pivotal role in shaping both the delivery of care and the experiences of those involved. Discourse, encompassing the ways in which language and communication influence understanding and behavior, extends far beyond mere conversations between healthcare professionals and patients. It encompasses institutional policies, public health narratives, medical education, and the broader societal dialogue about health and wellness. Effective discourse in healthcare is critical for a variety of reasons. For practitioners, it affects clinical decision-making and patient interactions, influencing how care is provided and how medical advice is interpreted. For patients, the language used in health communication can impact their understanding of diagnosis, adherence to treatment plans, and overall engagement of the healthcare system. The intricate interplay of language and meaning not only influences individual health outcomes, but also reflects and perpetuates societal values and biases. By examining discourse in healthcare, whether through the lens of patient-provider interactions, policy discussions, or media representations, we gain insight into how health issues are framed, how power dynamics operate within the healthcare system, and how we might improve communication practices to better meet the needs of diverse populations. Understanding the nuances of healthcare discourse is essential for fostering a more equitable, and effective health system. It prompts us to consider how we talk about health, how we listen to those in our care, and how we address the broader narratives that shape our collective approach to health and well-being. Problem statement. In contemporary healthcare settings, where technological innovations and data-driven approaches are increasingly emphasized, there is a growing concern that the essential aspect of human interaction is being undervalued. This shift towards a more mechanistic view of healthcare can deteriorate the quality of patient care, leading to potential gaps in patient satisfaction, adherence to treatment plans, and overall health outcomes. These are the research objectives. Objective 1, to analyze the communication styles between doctors and patients, and Objective 2, to investigate the speech acts used by doctors to connect with their patients. Which leads us to the research questions. Question 1, what are the communication styles used by doctors and patients? And Question 2, how does a doctor connect with their patient via speech acts? This article is regarding the first objective, Discourse and Mental Health by Juan Eduardo Bonin, 2019. This book is about the human connection and autonomy through discourse analysis. It focuses on the relationships between diversity and inequality in access to mental health care and the entire process and its outcomes, arguing in favor of a critical, situated perspective on discourse analysis, theoretically and practically oriented to social change. The objectives is to propose a critical discourse analysis for mental health care settings and examine doctor-patient communication from a locally grounded ethnographic perspective. The findings are explored discourse practices in mental health care for diverse patients and advocated for critical discourse analysis for social change in healthcare. Next, Discourse and Health Communication by Gavin Brooks, 2021. About the article, health discourse plays a crucial role in healthcare communication, shaping how individuals understand and convey health experiences, interact with healthcare providers, and navigate treatment decisions. The objectives are explore discourse in health communication and showcase established and emerging discourse analysis approaches in health research. Findings are explores discourse in health communication context and analyzes communication about health and illness. And lastly, interactional sociolinguistics tracking patient-initiated questions across an episode of care by Maria Stubb, 2021. About the article, discourse and communication styles in healthcare are diverse, often studied separately. This paper emphasizes the need for interdisciplinary collaboration to enhance understanding and application in healthcare communication research. The objectives are analyze patient-initiated questions in healthcare communication and bridge disciplinary gaps in healthcare communication research. The findings are studies in healthcare communication vary in methodologies and traditions. Humanities and social sciences focus on observation and institutional analysis. Now, this article is regarding the second objective, the analysis of speech act in verbal communication between healthcare professionals and patients in public health center branch Kerobokan Kelo by Nikomang Purwaningsih 2019. About the article. This article is about analyzing speech acts in healthcare communication for effective patient interaction and exploring illocutionary and perlocutionary acts in verbal communication. It also studied about micro-pragmatic aspects like implicature, relevance, and presuppositions in speech. The objectives are understanding communication functions, address misconceptions, and contribute to patient satisfaction. The findings are identified speech acts in healthcare communication between professionals and patients, recorded unethical speech in healthcare services affecting patient outcomes, and used observation to analyze conversations and improve healthcare communication skills. So this is the summary of the literature reviews collectively. Communication and interaction plays a major role in the healthcare industry to ease the process between the patients and doctors. The doctor's choices of words matters to the patients as they need to communicate using easy terms to increase better understanding. Study shows how doctors that use a soft and welcoming tone tend to make patients feel safer and eases them to open up regarding their health problems. The mini research that I'm conducting uses a qualitative method approach to analyze the communication styles between doctors and patients and to investigate the speech acts used by doctors to connect with their patients. Secondary data will be used as the primary source of this research. These are the findings that are found in a couple of journals for the first objective. There are lots of communication styles used in the healthcare settings. For example, the defined style. Doctors with a defined communication style maintain the same style regardless of patient characteristics or context. They believe clinical medicine is technical and not dependent on physician-patient communication. These doctors provide information to each patient in the same way and often intentionally avoid small talk, which can impede building rapport with patient. Adaptive style. Doctors with an adaptive communication style adopt a style appropriate to individual patient characteristics. They focus on establishing a functional patient-doctor relationship during the clinical encounter. Patients of these doctors are more likely to engage in the conversation and seek further explanation from the nurse. Speaking of the nurse, collaborative style. Doctors with a collaborative communication style rely on nurses to assist in communicating with patients. They are motivated to improve patient-provider communication, provide the best treatment possible, and foster patient trust. These doctors are more likely to have an adaptive communication style themselves. There are also other styles such as analytical style, intuitive style, functional style, and personal style. Analytical style is loving facts, hard data, unemotional, logical thinker, and only likes specific language. Intuitive style is a big picture thinker, likes to be quick and straight to the point, typically does not like step-by-step information. Functional style enjoys detail. Doctors who uses functional styles enjoys detail, timelines, and well thought out plans, enjoys step-by-step communication, and can be stuck in the details. And those who prefer personal style values emotional language and connections. Relationships often thinks in feelings or emotions. The relationship is more important than the information exchanged to them. And these are the findings that are found in a few journals for the second objective. Speech acts used between doctors and patients consist of directive speech acts, assertive speech acts, and expressive speech acts. Directive speech acts, such as asking questions. Asking questions is one of the most common ways doctors initiate interaction and gather information from patients. Questions allows doctors to get a clearer picture of the patient's conditions and concerns. Asking questions also helps patients feel heard and understood. Providing explanation. Doctors use explanation to educate patients about their health, diagnosis, and treatment options. Clear explanations help patients understand what is happening and feel more involved in their care. Explanations are a key part of shared decision making too. And lastly, making suggestions and recommendations. Doctors provide suggestions and recommendations to patients about the best course of treatment. Directive speech acts like this help guide patients while still allowing for their input. Doctors aim to provide recommendations that align with the patient's values and preferences to ease them. Assertive speech acts, such as asserting facts. Doctors use assertive speech acts to state facts about the patient's conditions, test results, or treatment plan. Asserting facts help establish the doctor's expertise and authority. However, doctors balance this with other speech acts to maintain a collaborative relationship and make it safe for them. Expressive speech acts. Expressing empathy. While less common than other speech acts, doctors do use expressive speech acts to acknowledge the patient's feelings and experiences. Empathetic statements help patients feel understood and cared for on a personal level and not just as a medical case. Conclusion. Based on the findings, doctors have a lot of ways to communicate with patients while making them feel connected as well. Effective doctor-patient interaction is critical for providing high-quality care. It involves active listening, using clear and concise language, showing respect, and adapting one's style to the patient's preferences and needs. It is also critical for doctors to use a variety of speech acts. The highlights from the findings is to build a connection with patients, gather information, provide education, make recommendations, and express empathy. The specific speech acts used depends on the doctor's communication style and the needs of the individual patient.